Morning. I want to thank you for being available on short notice. Obviously, um, we wanted to have a special discussion with the media to talk about some of the steps that we're taking as Ballad Health. Let me give you a little bit of background first, and I think it's important to remind ourselves what Ballad Health was intended to do. Rural hospitals all over the country are struggling. Um, just today, there's an article that I would point to in the cover of Modern Healthcare that 25% of America's rural hospitals are predicted to close. Um, Yesterday, the largest rural health system in the country declared bankruptcy. These are real issues, and these issues were brewing even before the pandemic occurred. And of course, now with the pandemic, rural and non-urban communities face a very different challenge. There are health systems that serve predominantly wealthy communities. There are health systems that serve areas of the country where more than half of their patients have private health insurance, and they deliver handsome profits for their shareholders. And good for them. That's their business model. The Ballad Health business model was designed to be a safety net for an entire region the size of New Hampshire, a rural region that has unique challenges with social determinant issues of access to care. Um, and that was why we were created. We wanted to sustain these rural hospitals, and we've been doing that. While other hospitals have closed throughout the country, we've reopened one or opened a new one, America's newest rural hospital. Just last month, we announced, or a couple of months ago, we announced that we're reopening a previously closed rural hospital. So we've been frankly bucking the trend, and it's because of the business model that was very uniquely created by Ballad Health, which was to utilize our tertiary hubs to help subsidize those rural access points. And that makes us very unique. Now, what also makes us unique is most of those rural hospitals typically lose money. They were losing money before the merger, or they were losing money before the pandemic, and now they're losing money after the pandemic or during the pandemic. But also our tertiary hospitals that typically are the ones that provide the resources for our rural hospitals. Now those hospitals are losing money largely because of what has occurred with the deferral of all elective procedures. We have seen up to 70% reduction in our business since this all started. And I need to say, our business actually started declining before we were told to reduce our elective procedures. Consumers themselves made the decision because they're smart, they understand what's going on. There's a pandemic. They themselves stopped coming to doctors' offices and to hospitals and to ERs, which was the right thing to do. Um, the net effect of that is it has a traumatic effect on the financial stability of any health system. And what you're seeing across the country that began 2 weeks ago is a cascade of actions by health systems to mitigate the potential losses related to all of this. Two of the largest Catholic health systems announced thousands of furloughs. The largest hospital system in the country announced earlier this week that they're reducing pay by 25% for all employees who are called off or flexed off from their hours. And so we're seeing a whole variety of approaches to this. And I think it's important to educate people about how Ballad Health and how hospitals generally staff. Hospitals staff based on volume. If a hospital is busier, then they hire more staff. If a hospital volume goes down, then staff generally gets called off. We staff based on the volumes that we have. And in an environment where you have a 5 to 10% variation in volume, that's the routine course of business. What's happened over the last month is there's been a dramatic, a catastrophic decrease in volume, which means that there's not enough volume to support the workforce that we have. When you have 15,000 employees and 100,000 admissions a year and 4 million patients a year, that same model doesn't work when you have 15,000 employees with 50,000 annualized admissions and 75% of your outpatient volume and outpatient visits gone. It's a business model that can cause your cash to evaporate quickly, and it can have long-term implications. A system like Ballad Health, and this is true for any rural community, whatever cash these health systems lose now, it will be very difficult for them to recover that cash later. And that's why you see so many of these systems that are struggling right now. Is many of them are struggling with very few days cash on hand, and frankly questioning whether or not they can make their payroll in the coming weeks. So what we've chosen to do as Ballad Health is over the last 2 weeks, we've been very methodical about trying to figure out what it is we have to prioritize. And the most important priority, clearly, is taking care of our patients. And so what we're doing here is a combination of steps designed to make sure we can fill the needs of our patients and frankly take care of our staff. We've taken a lot of time to investigate the details of the stimulus bill that was passed, the CARES Act. So we have a good understanding of what's in there that was created as a lifeline to hospitals, to small businesses, to all businesses, and to the team members that are affected by decisions that businesses are having to make. I want to say, it's important to note an organization as complex as a health system. You can't have a one-size-fits-all approach. You have to approach it based on the complexity and the differences in the types of team members that you have. And so we really have three different types of team members that we're approaching here. The first is we are making before I talk about the team members, let me talk about one announcement that I mentioned on Twitter last night. If you are a member of the community that has benefited from the services of Ballad Health and you have liability to Ballad Health out of your pocket, you have a patient liability, you have a high deductible, or you have co-pays that you are in the process of paying, if you can afford to keep making those payments, we encourage you to do so, because Ballad Health is feeling this crunch just like all other businesses are. But if you find yourself in a difficult financial situation, we understand that feeding your family and paying your rent is probably more important to you than paying for a past medical bill. So what we would say to you is, if you can't afford to make your payment for the next 90 days, we will not be taking any collection action. We'll continue to bill you to remind you of the amount that's owed, but we will not take any collection action related to your liability to Ballad Health. If you are currently in litigation or any type of collection action, we are suspending that action. We encourage you to reach out to Ballad Health and make proper arrangements. All of us want to be responsible. We know that our customers want to be responsible. We want to be responsible as well. So that step is a step we're taking to provide some relief to people, many of whom have lost their jobs, who are furloughed themselves from their jobs, or who have lost their savings and right now face a lot of uncertainty. And we want to make sure that we're being responsive to those needs, and we understand that. As it relates to our team members, we are announcing that we are making an added investment for certain frontline caregivers, RNs, LPNs, respiratory therapists, and nursing assistants. Those are the folks that are immediately at the bedside, whether they're in the emergency department or on patient care units. Number one is we're planning to possibly ramp up for a potential surge related to the COVID-19 virus, or even as things get better and we need to begin to plan for ramping up of our team members of our business, we need our frontline nurses. We can't have a hospital without nurses and nursing staff and the direct staff that supports those nurses. So we're announcing that we're providing full-time guaranteed hours, or let me rephrase that. We're guaranteeing the hours that you are in our system for. If you are a full-time nurse that works three shifts, meaning 3 shifts one week, 3 shifts the next week, which gets you to a 0.9 FTE, we're guaranteeing you the 0.9 FTE. If you are an LPN, nursing assistant, or a respiratory therapist, we are guaranteeing whatever hours you are in our system for. If you're full-time, we're guaranteeing you full-time hours. If you're part-time, we're guaranteeing you those part-time hours. Even if you're called off, we're going to guarantee you those hours. Now, I've seen where some systems are providing a 75% payment or a 50% payment for people that are flexed off or called off. Ballad Health is providing a 100% full-time guarantee for those team members. Why? Because we need you. We need you here now. We need you in the event there's a surge. We've seen several stories where some people that are nurses or other healthcare professionals have chosen to go to hotspots to provide their services to other areas of the country that have current needs. And we certainly applaud that and respect that. But we also urge you to consider staying here because we may have needs here. And if you leave and go to a hotspot, you can't come back unless you're first quarantined for 14 days to make sure that you're safe for presentation to patients. So if you leave, you can't come back. So for those team members that we're providing these guaranteed hours for, we're expecting that they will not travel outside the region, that they'll remain here to be available. We're going to pay you for that. We're also asking that there may be other services you can provide, even if you can't provide bedside services in the near term because the volume isn't there to support you. We may need you to do other things like training for our information technology conversion that we're doing, or even providing services in our call center. We may call upon you to help, and we would certainly hope and ask that you would do that. The second population of team members that I want to talk about are a lot of our team members who have been already for the last 2 weeks have been either called off or had their hours flexed down. If you make a gross salary of $45,500 a year in Tennessee or $50,856 a year in Virginia, if you live in Tennessee and make $45,500, or if you live in Virginia and make $50,586 a year gross pay, it is likely, because of what Congress did, it is likely that you will benefit more by not being on our payroll during this period of time and taking advantage of the federal stimulus bill that was provided. That stimulus was provided for a very explicit reason. It was provided to help team members who have faced reduced hours, and it was provided to help employers who are absorbing the cost of sustaining a labor force even when you faced a massive loss in your business. Well, that's the situation Ballad's in, and it's the situation our team members are in. So there's a group of team members that will benefit enormously from the support that Congress has provided. Now, keep in mind, Ballad Health will be continuing to provide. This is actually going to cost Ballad Health money as well, because when you do go on unemployment benefits, the state portion of those benefits, in Tennessee, it's $275 a week, up to $275 a week. In Virginia, it's up to $386 a week. At the state level, employers are charged back for the cost of unemployment. So Ballad will be contributing to that. Plus, the federal government will be contributing $600 per week. So if you are making less in Tennessee, we'll use this example. If you're making $45,500 a year or less, and you have faced a reduction in your hours, in many cases, our employees have faced a 70, 80, 90% reduction in their hours because of the lost volume. In those cases, those team members will make more money by being furloughed. And frankly, we think this is the right thing to do for them, and it's the right thing to do for Ballad Health. And it represents 70% of the people that we're announcing that we are implementing a furlough for. I have spoken with Commissioner McCord in Tennessee, Jeff McCord, who's the commissioner that oversees the unemployment system. And we've made special arrangements with Commissioner McCord such that we will provide the list of team members to the commissioner's office, and they've agreed to register those team members. So the team members that live in Tennessee will not have to go and apply. We have handled that for you. The only thing you will need to do will be to go online and on a weekly basis validate that you are still furloughed by your employer. And we are providing information to those team members directly. I will say that these team members, while they are on furlough, they will receive their full health benefits and their full pharmacy benefits from Ballad Health. Not only will they receive their full benefits, but Ballad Health is waiving their out-of-pocket portion of their premiums. So whatever your premium contribution was during this furlough period, you will not have to pay your out-of-pocket premiums for either your pharmacy benefit or your medical benefit. Plus, you can be recalled at any time. It is entirely likely that as volumes become volatile and start moving, some may move up, some may stay down for a while, but we may call you back. The expectation is that you will return when you are called back in. I understand that for a lot of these team members, they will make more money on unemployment benefit than they made working because of the enhanced benefit provided by the federal government. That should not be an incentive not to come back to work. When you're called, we do expect you to come back. If you choose at that time not to come back, then we would certainly consider that to be a voluntary resignation. Then the third group of team members that this is going to affect are primarily administrative team members that are higher income earners. These are folks that work mostly in corporate or administrative functions. And these are folks that we are placing on furlough. They too will benefit from the congressional action that was taken, the $600 a week plus the state unemployment benefit. For these employees and for the 70% of the employees who are being furloughed who are volume affected, meaning they're the ones that I was just talking about, we're permitting, our typical policy is that we permit one cash out of paid time off per year. That cash out is for a maximum of 40 hours. We are waiving that policy so they can cash out up to 80 hours of their paid time off prior to accepting the unemployment benefit. So there's several steps we're taking where they can benefit from dollars that they have accrued for paid time off. Now, I've noticed over the last week that many health systems are permitting their team members to borrow, go negative on their paid time off, meaning once they exhaust their paid time off, they can then borrow against future paid time off accruals. I'm not sure why we would do that to our team members. I don't think imposing additional debt on our team members is necessarily the right step. This is what Congress intended with the action they took. The stimulus, the CARES Act, was designed to prevent employees from having to borrow against their future paid time off. It was designed to prevent employees from having to eat away at their time off. And that's why we believe it's better for team members to go ahead and take advantage of the stimulus that was provided by Congress, and for which we are very grateful. And so those are sort of the actions that we are taking right now, in addition to a few other actions. Number one, the CARES Act permits team members to borrow or take an advance on your retirement up to $100,000, meaning if you've saved for retirement, typically there's a 10% penalty on top of your routine income taxes. Congress has said for up to $100,000, you can withdraw funding from your retirement plan and not have that penalty if your withdrawal relates to difficulties related to the coronavirus pandemic. Certainly this would qualify. So our Human Resources Department is providing information to our team members about how to access that benefit. Some other steps that we are taking that I think are relevant here. Number one, all of our senior vice president and above positions within Ballad are going to take a 20% reduction in pay. We're going to do that for 60 days. We'll reevaluate it in 60 days. That reduction in pay is effective this coming Sunday with the new pay period. I should say that the furloughs are effective Friday at midnight. And then anybody who's in an assistant vice president or vice president category will have their base pay reduced by 10% during this time period. So everyone that's in a senior management role is taking a pay reduction. And as I've already previously announced, I'm foregoing 100% of my pay during that same 60-day period. What's really important, I think, for people to understand is it's difficult to make decisions like this. We certainly don't want to be making decisions like this if we're not demonstrating to our team members that we're not willing to do the same thing. And that's why I'm foregoing 100% of my pay, and I will not be accepting any alternative payment. I'm not seeking unemployment or any other type of remuneration during this period. Other actions that we're taking, the medical group, which is governed by a group of physicians, they have opted to impose a 20% compensation reduction amongst our physicians and advanced practice providers throughout the system. This is an important thing because if you go talk to any private physician group right now in the region, that, I'm not going to name names, but they're out there and you know who they are. These physician groups are facing a very difficult time right now. In many cases, they're having to make some of the same decisions that we're making, and you know, they've seen a 50 to 70% reduction in their own volume, and that has a tremendous effect on their cash flow as a physician group. The same thing has happened with the Ballad Health physician group. And I think our physicians have felt that if our team members are being asked to sacrifice here, they wanted to do the same thing, and I give them great credit for volunteering to do that. Our overtime in non-clinical departments will not be approved. We will permit overtime in clinical departments, certainly, but not in their non-clinical departments until further notice, unless exemptions are specifically approved by our senior executives responsible for those departments. All of our spending on our COPA-related plans is suspended for the time being, based on to comply with the state's agreement that we have faced a force majeure event that triggered a material adverse event. We appreciate the states granting that flexibility during this period of time, because we do need to refocus our resources, as we're doing here, on our frontline caregivers, and that's what we're doing. All capital spending is suspended unless I've personally approved it. Any spending on outside consultants is suspended. We are adjusting our par level of our supply inventory to reduce our supply costs, which obviously is logical. We are suspending retirement contributions for this current fiscal year. We are also suspending accruals for paid time off for department managers and above. That goes all the way up to me. So from now through the end of June, there will be no new paid time off accruals for the remainder of the year. And there may be some other steps taken on a market-by-market basis to consolidate certain services as necessary. There will be some announcements that we'll make in the coming days. They're very logical. Where we've seen virtually no volume in certain care sites, it makes sense to consolidate some of those sites with other sites to make better use of our resources, and we will do that. And we will certainly make those decisions known as they occur. I want to just reiterate a few things. Number one, we are making some significant investment here. When I go out and talk to some of the other healthcare system CEOs, one of the things that struck me is a lot of them are saying if you have team members that are called off or are flexing their hours down, what they're doing for their team members, and I applaud this because they are doing something for their team members, but what they're doing is they're telling their team members, you'll get paid 50% of your pay, or you'll get paid 75% of your pay. What we're doing for team members that are being furloughed here, for 70% of them who make below $45,500 a year, if you live in Tennessee, or $50,586 a year in Virginia, what we're telling those team members is you can make 100% of what you were making, and that's a big deal for our nurses, for our LPNs, for our RNs, for our respiratory therapists, for our nursing assistants. We're guaranteeing 100% paid for by Ballad Health. We are guaranteeing them full-time hours, or hours full to what your FTE is. Meaning, if you are in our system, if you are always a 0.75 FTE, we're guaranteeing you 0.75. So you don't, even if you're called off, you're going to be paid 100% of what you would have been paid. And that's a very, in my view, it's generous, but it's also intended to demonstrate to our folks that we are serious about keeping this team in place in the event we need them for a surge related to COVID-19 and to ramp our services back up. The team members right now that are probably facing the biggest challenge is going to be those higher income, primarily administrative team members who earn more money, who are in fixed jobs. They're not variable, but they're full-time exempt positions. And those folks that are being furloughed will face probably a reduction in pay during the next 60 days. The unemployment benefit, the enhanced unemployment benefit will help them. Plus, we're making accessible to them the 80 hours of paid time off that they can unlock in advance of that to help smooth that over for them during this period. So we are investing more in our critical frontline staff, 100% guarantee of full working hours. We are taking full advantage of the life raft that was provided by Congress for employers and hospitals. And I want to, while we're also paying the premiums for all of these employees who are being furloughed, we are going to pay for their health insurance premiums and their pharmacy benefits, and they will receive those benefits. So they don't have to worry about anything happening with respect to their health care for them or their families if we're their plan for health care. We are reducing our administrative cost. We have to do that right now in order to sustain our solvency in the market. And I have to say this from the perspective of the economy. Here's one of the more important issues for our business community and why this is so important for our business community. If 2/3 of the people, more than 2/3 of the people that we're furloughing, were at home not working or receiving lower income because they were being their hours were being reduced, those are dollars that were coming out of the economy. By taking full advantage of the stimulus bill, which is why this is called a stimulus bill, by taking full advantage of that stimulus bill, that's $600 per week that Congress has funded. That's pure economic effect on our region. That's $600 a week for each of these team members that is coming into the region that they can spend. If they were sitting at home and we were cutting their pay by 25% or 50%, that's money that's coming out of the economy. 2/3 of the people that are affected by this may make almost up to their full salary, which we couldn't have done before. So I think this is actually impactful to the local economy in a way that I think is really important and was part of our consideration for this. And I think finally, when I talk about reducing the administrative cost, again, I want to reiterate why this is so important to Ballad. Right now, we're projecting over a 90-day period to face up to a $155 million loss. That if we lose $155 million, we won't recover those dollars in cash unless the federal government comes up with a plan to restore those dollars. And to some degree they are. There has been some relief in the stimulus bill, but it doesn't replace those dollars dollar for dollar. And in a region like ours that faces no population growth, that faces declining inpatient utilization rates, when you come out of this, you can't assume 100% of that volume is going to return right away, and it's going to be very difficult to recover that lost cash. And that lost cash is important. We face as a health system, like most health systems, we have bond debt that, we have new hospitals in Abingdon, Virginia, Smith County, Virginia, Norton, Virginia. Some significant dollars were spent there in capital. Significant capital has been spent at Holston Valley and at Johnson City Medical Center, a new hospital, Franklin Woods, a new hospital in Unicoi County. All of those assets cost money. And to build those assets, years ago, debt was incurred. When you incur debt to pay for those types of things, you have liabilities to your debt holders. And those things come in the form of bond covenants. And what we're keeping an eye on is making sure that Ballad Health balances the need to take good care of our team members, to take good care of our community, but keeping our word to our debt holders. And right now, I think all of those things are an important balance. I think we're going to be responsible stewards. And I'll close with this, and then I'll answer any questions you might have. We are human, and this is a big action. This is affecting a number of people. And when you take an action like this that affects this many people, there's certainly the chance that there's mistakes, or that there's oversights, or there's things that we did that we will learn that we shouldn't have done. We get that, and we acknowledge that. And so the direction I've given our team is to be flexible, to be agile, to be able to respond to the unique issues some of our team members have. I mentioned that I contributed my compensation to the Team Member Assistance Fund. That fund is it's funded largely by team members who over the years have contributed because they want to support their fellow team members. I feel the same way. And those team members will benefit. Many team members have benefited from that fund. Team members who have lost their homes to fire, team members who have faced unique economic circumstances. So in this particular issue, If we have team members, whether they're involved in this decision or not, if they face unique economic challenges, they certainly have at their disposal the ability to go to the foundation. In terms of total numbers, this affects less than 10% of our workforce. All this action in terms of the furlough is less than 10% of our workforce. We have lost up to 70% of our volume, but this affects less than 10% of our workforce. 70% of the people that are affected will actually be able to sustain all or most of their income by virtue of the federal stimulus bill. And we are actually going to be spending more money on nurses, LPNs, respiratory therapists, and nursing assistants because of our commitment to guaranteed hours. And that's a really important commitment. And I'll say quite frankly, I'm not aware of any health system in the country that has guaranteed full working hours for clinical staff that have been called off. And we are doing that, and we intend to fulfill that. 70, as I mentioned, 70% of the team members that are affected, that's 953 of them, are below that threshold of $45,500 a year or $50,586. And those are the people that we believe will benefit more from being on the unemployment benefit and keeping the insurance and pharmacy benefits that we're going to be providing. The total number of team members affected is about 1,300. That's in total. We have about 15,000 total team members, and so this is a big decision for us. Now, I will tell you, as you go around the country and you look at some of the other systems, Cookeville, I believe it was either Cookeville or Clarksville, the hospital there yesterday announced, or earlier this week announced, I think 400 for one hospital. Erlanger, I don't know their number, but it's a sizable decision they made. I noticed that Bon Secours Mercy and Trinity combined over 5,000 team members, I believe. The numbers are pretty big all over the country. The good news is that as we start to ramp our volumes up, we expect to call these people back, and that's our hope. And so our prayers are with everybody. I know there's some uncertainty. Our team members are being notified of this as we speak. And our human resources function is fully prepared to answer questions and provide assistance. And if there's any questions people have, I encourage them to reach out to human resources and use that process so that we can get answers to them as soon as possible. I appreciate the time, and I'm certainly willing to answer any questions.
All right, we will go ahead and open it up for questions. We have David Floyd with the Johnson City Press. David, do you have any questions?
Hey, yeah, you guys have an anticipated time frame for how long these employees will be furloughed?
Yeah, in fact, David, let me answer that in 1 second. There's one piece of data I neglected to share. This furlough overwhelmingly affects Tennessee more than it does Virginia. About 220 of the team members, give or take. It's important when you report these numbers. These numbers are approximate. And I need to say, when you talk about the total number of furloughed team members, the 70% who are below the 45,500, most of those team members were already facing reduced hours. So it's hard to say how many are incrementally being furloughed. Probably the right incremental number of people who are not being called off or flexed down, it's more about 620 people that are administrative in nature that were exempt. And David, I'm going to get back to your question, but I wanted to make sure I clarify these numbers. The corporate administrative furlough really is about 620 people. The 900, the rest of the numbers, and these numbers won't all add up, I should say. There's a lot of gray area because a lot of the team members who are being furloughed were already not working, but we're getting paid nothing, or we're using their PTO. And so to say they're now furloughed, it's accurate, but it's also accurate that it's actually a better situation for them than the situation they were in. But in terms of the numbers, about 1,100, and I'll verify these numbers later, but about 1,100 of the total are in Tennessee, and about 200 to 250 are in Virginia. And that's logical since overwhelmingly our larger facilities and our corporate functions largely are in Tennessee. David, your question is how long will this be? I can't put an end date on it for sure because we don't know the length of this. what I would say is we're going to reevaluate this in 60 days. And let me also say, this furlough could last, a few days for some people, because department supervisors and managers might find that, for instance, in physical therapy, there's a spike in volume in physical therapy. I had a team member reach out to me this morning to talk to me about the important work they do in physical therapy. And I appreciate his email. He's right. And it might be that we need to call physical therapists back to deal with a spike in volume because the length of stay is longer, because we can't discharge to nursing homes right now in some circumstances. And so we have to begin physical therapy in the hospital. If that's the case, the furlough for some of those team members may only last a few days. So our plan is to revisit this within 60 days, but it's going to be an ongoing issue. There will be people called back before that 60-day period, depending on the needs of the organization.
David, do you have an additional question?
I do, yeah. You talked a lot about the economic fallout of the outbreak to Ballad Health. Are you guys confident that you guys are going to be able to bring staffing levels back up to the level that they were before the outbreak?
We're overwhelmingly, we staff based on our volume, and that is 100% dependent on what happens with the volume. There are schools of thought that there's pent-up demand for elective procedures, and I think that's true. But I also think there's going to be a period of time where people are going to be very slow to return to the healthcare setting. You're seeing a huge expansion of telemedicine now, which is a good thing. But you're going to find a lot of people that realize they don't have to return back to a doctor's office or to a clinical setting, because the use of technology may now replace that. And so we don't know. And so I don't want to make commitments or say something that later proves not to be doable. What I can say is our goal, as much as possible, is to grow Ballad Health. As Ballad Health grows, we need more people. And if the volumes return, we will want to bring all these people back. If the volumes don't return, we've got to be thoughtful about how we bring them back. We will staff to the volumes, and we encourage people, as soon as it's determined to be appropriate to return for elective procedures, we will encourage people. We will, number one, we will make the environment safe, and we will do everything we can to encourage people to return to their providers, and if they were putting off procedures, to come back and have those procedures done. I think that'll be good for them, particularly if they're experiencing pain or other reasons why they were seeking those procedures to begin with. And then obviously economically, that would be good for Ballad. And I want to reiterate, you mentioned the word economic in your question, David, and you weren't asking this, but I'll answer it. And I've said it during my comments, and I want to repeat it because it's so important. By doing what we're doing and taking full advantage of the stimulus benefit, we are bringing more money into this region. The worst thing we could have done would have been to tell our team members, we're going to have you stay home or flex at home, and we're going to pay you 75% of your pay, or we're going to pay you 50% of your pay, or we're not going to pay and you can borrow against your PTO. That would have taken money out of our economy. By bringing $600 a week from the federal government into our region, we're bringing outside money into the economy, which gives people money they can spend, which will help our small businesses when they start reopening. So that was part of our consideration in this. And I also will repeat, and it's really important this be said, while healthcare and healthcare organizations are essential, that does not mean every team member is required right now. Not every team member is critical for providing care for people with coronavirus or providing care for people that have emergencies or non-elective needs. We want you here and need you here if you are critical for providing care to coronavirus patients or providing care for emergent patients that have emergent or urgent needs, because those are the only services we're providing right now. The other services we're not providing, and therefore it's not appropriate for you to be in the setting. It frankly runs against the grain of the governor's orders and the president's orders to stay at home, or their encouragement to stay at home and not go somewhere if you are not needed at the current time to go there. So there's a safety component of this as well, where we're trying to prevent exposure to our team members. I'll point to Beaumont Health System, which has 1,500 team members that are currently furloughed or isolated at home. And I think Henry Ford yesterday announced 600 that are on isolation at home. We cannot afford to have that happen here, and that's why we don't want anyone in the work setting that is not critical to be in the work setting right now. David, I know you didn't ask those questions, but I thought they bore repeating, so we'll go on to the next.
Thank you, David. Next, we have John Engel with WCYB. John, do you have any questions?
Yeah, Alan, obviously, I can already imagine the Facebook comments that are rolling in about this action happening. Can you give us a picture of what the situation would have been had this action not been taken by Ballad Health? People will say that, being putting money ahead of people or whatever. What would have happened had these actions not?
Yeah, I think any rational person knows that if you put yourself in financial jeopardy as a health system, then you cannot fulfill your mission. Period. And when you are a system that has a cost structure in place that's up here and your volume goes down here, if you try to sustain that cost structure, you're putting yourself in financial peril. And so, caring for people and making sure that you act responsibly financially, those things are not mutually exclusive. You have to do both. And folks who want to make comments that are careless or not educated, they have the luxury of not being responsible for these assets. My team is. Our board is responsible for these assets. And it's not all milk and honey. You don't get to just be there when things are all really good. Sometimes you have to make hard decisions. And in this particular instance, why in the world, and I would ask this question, why in the world, when any rational health system cut their team members' pay or cut their hours and deprive them of a benefit that Congress unanimously, explicitly wanted them to benefit from? Congress overwhelmingly spoke with force that they wanted these benefits to benefit hospitals, and they wanted these benefits to benefit employees who were being affected by lost volume. The federal government told us to cut our volumes by 70%. That's what we've done. The federal government said, hospitals, we recognize you cut your business by 70%, so here's some resources we're going to provide to you to help soften the blow and to help your team members that are directly affected by the decision that we as the government made in telling you to defer these procedures. So we're doing exactly what Congress told us to do. John, there's a great story on the front cover of the Wall Street Journal, either yesterday or today, and it quotes very high profile and well-respected businesses all over the country that are saying the same thing I am. Why in the world would you deprive your employees of this benefit when it's been made available to them by Congress? I realize there are people that will be critical of decisions that we make. I understand that. That's what we signed up for. But that doesn't mean we shouldn't make the decisions. It means we've got to make them. We've got to be very thoughtful about how this affects our team members. And by doing some of the things we're doing with loosening up our paid time off policies, providing health and pharmacy benefits, waiving all of the co-pays, all of the premium contributions for our team members. And quite frankly, John, I'm not aware of any health system in the country that is guaranteeing full hours for nursing, LPNs, certified nursing assistants, and respiratory therapists. We are making a massive investment in that part of our workforce. And if you can find another system, I saw where the largest for-profit system in the country told their employees that were being waived off that they were going to pay them 75% of their pay. And frankly, the Vice President of the United States applauded that company for doing that in a tweet the other day. Folks, we're guaranteeing them their full pay. I do not know another health system that is doing that. We are guaranteeing full pay to more employees than the largest for-profit health system in the United States, or any other not-for-profit system that I'm aware of. I'm proud of that. I'm proud that our board and our management team placed a priority on those frontline folks that we absolutely have to have in the event we get a surge. It would have been easy to tell our folks to stay home and we'll pay you 75% of your pay and save 25% of our payroll cost. That would have been easy. But it's much better for our team members to be able to benefit from what Congress intended for them to benefit from.
John, do you have an additional question?
I do. Are you able to quantify how many team members are providing
You know, John, I'm glad you asked that because I need to make sure that's very clear because you got two different populations there. The nurses, the LPNs, the certified nursing assistants, and the respiratory therapists, where we're guaranteeing full pay, full hours. Um, that population, we're saying, please don't travel. Please stay here because if you travel and you come back, you're going to have to be quarantined for 14 days. And if we get a surge here, that means we can't use your skills here where you're needed. We're not saying that that population of team members would be voluntarily resigning if they travel. We're just saying that you're going to be unable to help. If you are a team member that's furloughed and we call you and ask you to return because we need you for a position or a job that you're qualified for and which we need you for to help in terms of either a surge or any other need that the health system has, and you say to us, look, I'd rather stay home and receive the enhanced unemployment compensation, then we're going to consider that to be a voluntary resignation. And at that point, we would go ahead and notify the unemployment office that we offered employment and it was declined. So it's two different populations, and that's an important distinction, John, because we need our nurses, we need our LPNs, we need our support staff that support bedside nursing, and we need them to stay as much as possible. The first part of your question, I don't know the number. I know I've seen reported 2 respiratory therapists recently that went up to the hotspot. If they come back, they can't come back to work for at least 14 days. Until it's 14 days, and we have to confirm that they haven't had exposure, which means that if we have a surge in the next 2 weeks, they can't help us. So what we're asking for is to try to first make sure we care for this region, because I think you're seeing growing hotspots. While New York seems to be cresting, you're seeing it in Florida. You're still seeing a lot of issues in other parts of the country that haven't yet crested and that are growing. And it's happening a lot in non-urban and rural areas. Just as we're continuing to see growth right now, they are too. And we want to make sure our staff is here to take care of our community.
Thank you, John. Next, we have Scott Robertson with the Business Journal. Scott, do you have any questions?
Thank you. Alan, you mentioned the possibility of a $155 million loss over the next 90 days. That money doesn't replace that dollar for dollar. How close does it come, or another way, without having to do the math? How much money are you anticipating getting for Ballad Health from CARES Act?
We're still evaluating that. There's several different buckets that were provided in the CARES Act. Three or four in particular that we're looking at. One is obviously the direct payment to hospitals due to lost volume. We don't know how that's going to be distributed. I heard yesterday that they were planning to distribute that based on your Medicare payer mix. I'm very concerned about that because in our community, we have the second highest penetration for Medicare Advantage, the replacement insurance for Medicare fee-for-service. If the federal government uses Medicare fee-for-service as the mechanism for determining how those dollars are going to be distributed, systems like ours are going to be disadvantaged because in some of our counties, 60–70% of the Medicare population receives their Medicare benefit through United or Humana, one of those insurance companies. And if they don't include that population in the distribution formula, systems like Ballad are going to be heavily disadvantaged. So we're watching that part of it very closely. The second is the advance. Medicare is advancing payment for 6 months. That's going to be very helpful for rural hospitals and non-urban hospitals that really have major cash flow problems. It'll help us too, to help us restore. We've lost almost $200 million in cash already just from what happened in the market. Then you add the operating losses of up to $155 million, and that's a pretty big cash hit. By Medicare advancing payment to us, that allows us to put some of the cash back in the bank so that we don't have to draw down on our lines of credit, which we were certainly prepared to do if we needed to do that. So now that pot of money is not new money. That's money we're borrowing against ourselves. So the way that's going to work is we get that cash infusion now, and in 120 days, as we bill Medicare will withhold our payments. So we get that cash now, and then over a period of time, we're going to get paid nothing by Medicare as we repay those dollars. That's effectively a no interest loan where we're borrowing it against our future cash flow. We're grateful for it. I think it will be helpful. It will definitely be helpful for small rural hospitals that have no cash. And in our case, it helps us because, most of us we don't carry a high level of liquidity. We have enough working capital to carry our cash needs. I know I'm getting in the weeds here, Scott, but we have enough liquidity to carry our cash needs based on our normal forecasted spending. We certainly don't carry enough cash that's liquid to deal with a 70% drop in business and it's for a sustained period of time. So most health systems have been going to their banks and getting lines of credit. Ballad has been doing that. And we're hearing that some systems are seeking lines of credit of as much as $1 billion. We certainly have not sought that much of a line of credit. I think our limit, I think what we sought was about $250 million. So we'd have the line of credit if we needed it. And if we do draw on it, we have to pay interest on it. By virtue of the government advancing these dollars, that decreases our need to go draw on those lines of credit, which is very helpful to us. We're also looking at the Paycheck Protection Act to see, we have a lot of subsidiary companies that are small companies, to see if those might be able to benefit. We're looking at the Affiliate Act, the affiliate rules, to see if those affiliate rules affect our subsidiaries, because we do have many small businesses that could benefit from that. We want to make sure that was Congress's intent before we pursue that. Those are sort of three of the big buckets, but one of the biggest buckets of support for hospitals is the unemployment enhancement. That was, we lobbied actively for those dollars. Many of you might have seen where I was tweeting it and advocating it openly for enhanced unemployment benefits, because the enhanced unemployment benefit is the fastest way to get the money to consumers and to get the money to the marketplace. When we enroll these people in the unemployment benefit, they're going to start getting checks immediately, and those checks can circulate into the economy. And so that's why we were advocating for this. Ballad was advocating for this even before the act passed. I personally spoke with Senator Blackburn's staff and with other members of the U.S. Senate. I had email communication with people in Washington, and our lobbyists up in Washington were actively engaged. We think the unemployment enhancement is frankly one of the best life rafts they've given to employers, not just hospitals, but to whether you're a retail employer, a restaurant, or a business that's had to shutter your factory, as we've seen in Kingsport just last week with Domtar. I mean, many of those benefits, I was looking where some of the major factories up in Michigan are saying that most of their factory workers will benefit enormously from the employment benefit, where they're virtually replacing 100% of their pay. And so, Scott, I've been talking. I forgot what your question was. What was your question? And I hope I answered it.
Did that answer your question, Scott?
Pretty well. The other question I had deals with emergent care. If you're going to have a heart attack, you're going to have a heart attack. You're going to have a stroke. You're going to have a stroke. How have your emergent care levels altered, if at all, during this crisis?
Yeah, they have. The question is, how has our emergency care changed during this crisis? It has not. We are fully staffing our emergency departments. And in fact, the actions we just announced by investing in guaranteeing full hours for our RNs, LPNs, CNAs, and respiratory therapists, for that population of our team members, which is a majority of our clinical team members, the commitment we're making to the full-time hours is intended to bolster our emergency departments and our bedside nursing. So the actions we're taking are intended to bolster that. And even if we see a surge in volume in the emergency departments for any reason, we're in the position where we can recall these team members if we need them. And that's why we're saying, if you're recalled, you need to come back.
Thank you, Scott. Next, we have Brittany Nave with the Elizabethan Star. Brittany, do you have any questions?
Yes, I do. So my first question kind of goes in with the furlough employees. What skills would they need if numbers increase and they're needed to call back? Like, are they going to be looked at on a specific basis for what exactly what they performed to be considered to be brought back, or would anyone?
Well, that's a great question. The question is, what kind of skill sets might we need for if we call people back? And again, the way we're designing this is so that if we need team members, if we see a surge and there's a specific type of skill that we need that we don't need right now, we're in the position to recall them and have them come back immediately. And that's the beauty of the benefit that the Congress provided, and which we're grateful for. Look, right now today, where there is no surge occurring, if you're a nurse that is being called off, number one, you're going to be paid as if you're working. Number two, so I'll give you an example. We're planning to convert to Epic, the information technology platform. I think you said you're from Irwin. The hospital in Unicoi is already on Epic. We converted that hospital months ago. And it went quite well. But the nurses may be asked to go do training for Epic, which is something we need to do before we convert in October. So we may ask them to do that. That's certainly within their skill set and it's appropriate. We might ask them to go serve in a call center where they can provide virtual services to members of the community that have special needs that use our call center. Look, and if we get a surge, it might be determined that it's all hands on deck and we need to bring a lot of people back. And you might have been in a clerical position before, and we need you to go up on the floor and provide support to nursing. We might need you to support daycare services for our team members. If we have team members that we need to work and they have nowhere for their kids to go, and despite the great volunteerism that's going on to support our team members, what if there's not enough? We might need some team members to say, look, we need you to take care of so-and-so's team members' children so that we can get that nurse back to work. There's all kinds of needs that may occur, and that's the benefit of having the Corporate Emergency Operations Center activated. They're here every day looking at every issue that arises. The Corporate Emergency Operations Center's responsibility is 100% problem solving. If an issue arises, they're putting teams together to address and problem solve those issues. And in many cases, when we're problem solving those issues, we might determine that we need manpower to help with resolving those issues. And that gives us the ability to recall people that are needed and bring them back. So that's kind of how we would envision this working.
Brittany, do you have an additional question?
Yeah, on the topic of the surge, as far as beds and ICU equipment and everything needed, do you all have plans in place in case the surge does happen and perhaps the models that are showing the numbers going down is wrong, if it does get worse?
I'm sorry, I didn't quite understand the question.
Can you please repeat your question?
Yeah, so with the new model showing that the numbers are going to be going down and it's not going to be as bad as originally expected, if those numbers are wrong, are there plans in place for enough hospital beds and ventilators, equipment, if it does get worse, are there plans in place for that?
Well, I would, let me make sure I'm very clear about this. I think it's, I don't agree with the premise that the models are wrong and it's not as bad as we thought. I think that, while I certainly understand why folks might say that, the reality is the social distancing is working and the steps that are being taken are slowing down the spread of the virus, which is exactly what we were hoping for. But the answer to the ultimate answer to your question is yes. Right now, we believe we've got the capacity. We have more than 200 COVID-specific beds available. As of yesterday, I don't have this morning's numbers yet, but as of yesterday, we had 13 COVID patients in-house. 2 of them are on a ventilator. And so we're certainly prepared to ramp up. And again, going back, this is why we're guaranteeing full hours for RNs, LPNs, CNAs, and respiratory therapists. We want to make sure that that critical frontline staff is absolutely available in the event we do get a surge. And while that's going to cost us more money, it's absolutely appropriate for us to do that. And it's the right thing to do with the resources that we have.
Thank you, Brittany. Next, we have Richard Rourke with the Irwin Record. Richard, do you have any questions?
Yes, I sure do. In regards to the Unicoi County Hospital, I just want to verify. I know that's a rural hospital. There's beds that were there in that hospital there. I just want to verify that that hospital is safe and all this.
Yes. All of our hospitals that are currently open and seeing patients will continue to do that. There may be some shifting around in certain types of services, depending on the volumes in those hospitals. But in Unicoi County, we already did that several years ago, and that hospital it still loses a good amount of money. I mean, that hospital generates about, uh, I'd say probably negative $4 million a year in cash flow. So that's one of the rural hospitals that's very special to us. It's an access point for a lot of people that need it. Ballad Health subsidizes that hospital with $4 million of negative cash flow, but we do that with gratitude for having the opportunity and the responsibility to care for the people in Unicoi County. We love that hospital, and it's not going anywhere.
Richard, do you have an additional question?
Awesome. Thank you for that. Yes, I sure do. In regards to Unicoi County Hospital and the furlough, if you give us, I know it's early, you give us how that will look for the Unicoi County Hospital, will there be staff that's furloughed, and if so, how much?
Well, Unicoi would probably be one of those hospitals where if they had already been flexing staff down, it's possible that there might be some employees that will benefit from being on the enhanced unemployment benefit. My hunch is, I don't have the numbers in front of me on that level of specificity, but I think there's probably very few, if any, that are at Unicoi. If there are, my sense is that they're probably going to benefit from being on the enhanced unemployment benefit that Congress provided, as opposed to being flexed off at home.
Thank you, Richard. Next, we have Blake Lipton with WJHL. Blake, do you have any questions?
I guess, Alan, is there any way you could break it down a little more by hospital, region, just how much of those workers are we seeing being cut from specific hospitals?
I don't have that specificity in front of me. We could try to get it for you, but I would caution against it because we have a lot of team members that cross different hospitals. I think if you were going to break it down, probably the overwhelming majority of the furloughs are impacting Johnson City, largely because that's where our corporate office is. My guess is probably Kingsport and Bristol come in behind that. Very little effect in Virginia. Less than 250 of the total numbers of the 1,300 will be coming from Virginia. But we could try to get some breakdown community by community. But like I said, in Kingsport, you've got crossover between Holston Valley and Indian Path. Johnson City, you've got crossover between those hospitals. It might be better to get it for you by community. But again, it's really, I cannot overstate this. There are a lot, 70% of the team members that make below $45,500 in Tennessee. 70% of them were more than likely already seeing reduced hours before this, but were not getting paid for it, or were using their paid time off. By doing this for them, it is very likely they're going to benefit more. And so when the word furlough is used, I don't know a better word for it. It is a furlough, but it's really shifting them from an unpaid leave, if you will, to paid leave, and it's being paid by a partnership between Ballad Health and the federal government, because Ballad Health is paying for the state portion and the federal government is paying for the federal government's portion.
Blake, do you have an additional question?
Yeah, and I know you talked about, possibly calling some people back, but are you assuming is the goal to eventually rehire all 1,300 workers?
Yeah, our goal is to bring all of our team members back. And as I said, the only caveat to that is it's driven largely by volume, and how fast we're able to do it depends on the volume that we see. And I'll say, it also depends on what happens with the current stimulus bill and if they do a phase 4. If we get federal relief, certainly we would take that into consideration. From our perspective, we're trying to balance making sure we're providing critical services with being good financial stewards. Those dynamics can change depending on how the federal government distributes dollars to hospitals. I'm encouraged that there's a lot of conversation about hospitals. I'm concerned about what I'm hearing is the current methodology for distribution of those funds, because I do think a system like ours that is very disproportionately high in Medicare Advantage versus Medicare, I think we're probably going to be disadvantaged by that. But we'll wait and see when we get it. But but there's a lot of different factors that come into play. But Blake, your underlying question is, yes, our intent is to bring our team members back as fast as possible. And I should be clear about that.
Thank you, Blake. Next, we have Eugenia Estes with the Greenville Sun. Eugenia, do you have any questions today?
No, I have my answer. Thank you, though.
All right, thank you,
Thank
Eugenia.
you.
Next, we have Taryn Young with the Coalfield Progress. Taryn, do you have any questions? All right, and next we have Mike Still with the Kingsport Times News. Mike, do you have any questions?
Yes. First, the 200 suggested for Virginia employees, does that extend all the way from the Tennessee line up to Buchanan and Dickinson County?
Yeah, yes, sir. Smith County, it goes from I'd say probably Wise County all the way up to Russell County over to Smith County and all of that general area. And it's about and in Virginia, I would say probably, if not all, certainly almost all of that couple hundred people that are affected are people that have been flexed down already. So this benefit should be a pickup for them based on where they were at before.
Mike, do you have an additional question?
Just one very quickly. Of course, now that you're talking about the possible probability of reopening Lee County Hospital, does this put those plans in any sort of abeyance or delay?
Well, our commitment to reopening Lee County is unwavering. We plan to reopen Lee County as a hospital. We plan to keep the urgent care open. It's been heavily used, and frankly, the people in Lee County have been phenomenal to work with. And so we love our neighbors there, and they've been through a lot. And so they've been through a lot of stops and starts. They had to deal, unfortunately, with an unseemly, I would go as far as to say, a really unseemly company that was there before that tried to take advantage of the situation. Ballad Health is and I'm referring to AmeriCorps, by the way, by name. Ballad Health decided to get up there and work with them to reopen that hospital because we want to make sure that they have the access point that other rural areas in the region benefit from. And that's unique to Ballad because most other rural hospitals are facing closure right now. We have delayed all capital spending for the time being until we get a sense of what our cash position is going to look like once we get through this. We're facing a lot of economic unknowns right now. Number one, we've lost up to 70% of our business. Number two, we don't know how much of that's going to come back. Number three, I was talking to several insurance plan CEOs over the course of the last week, and this is important. They're facing, the insurance companies told me, the number of people that are paying their premiums has decreased dramatically. So a lot of people, particularly in small businesses that can't afford to pay their premiums right now, they're foregoing that. And what that means is before all this happened, Ballad Health, only 22% of our revenue was commercially insured, making us one of the lowest commercial payer mixes in the United States. Now we're facing a situation where even more people are going without insurance benefits. So we don't know what all of this is going to look like financially. And so our plan is to stop all cash spending wherever we can, preserve our financial situation, and then once we have a better picture of what it looks like, then we can begin to ramp up on our capital spending again. So yeah, to some degree, this delays Lee County a little bit, but I don't want there to be any misunderstanding about our commitment in Lee County. And I want to be clear, we were not required to open that hospital. There's nothing in the COPA or the terms of certification or the cooperative agreement in Virginia that required Ballad Health to reopen Lee County. That was something we did because we wanted to do it, and we still do, and we plan on it.
Thank you, Mike. And then our last reporter on the line is Richard Lovett with Cumulus. Richard, do you have any questions? All right. Thank you all so much. That concludes today's media briefing.
Thank you very much.